Good morning, everyone. We are about to discuss the oral health program. So at the end of this lesson, student can define what is oral health, know the importance of oral health, understand the goal of oral health program, and lastly, they can enumerate the different programs of oral health. Oral health is a key indicator of overall health, well-being, and quality of life. It encompasses a range of diseases and conditions that include dental caries, periodontal disease, tooth loss, oral cancer, oral manifestations of HIV infection, oral dental trauma, NOMA, and birth defects such as cleft lip and palate. So the goal of this program is to promote good oral health for people of all ages within the community. The oral health program has two components: primary health services and the public health dental clinic. So kining primary health care service, mano siya ang mag-diagnose and treat common health conditions within their area of expertise. Also, they can assess the urgency of your medical problems and direct you to the best place for that care. So, ang dental public health, nag-focus ni sila on the health of populations in a non-clinical way.
Oral health promotion, education, and preventive services. Maybe some of you here wonders why we talk about oral health promotion, education, and preventive services, where the topic talks about oral health program. The goal of the oral health program is to promote good oral health for people of all ages. Technically speaking, oral health promotion, education, and preventive services are the contents of the oral health program to achieve the goal of the said program. Dental health educator coordinators determine the oral health needs of communities, provide health promotion and dental health education, and deliver preventive programs. Dental health educator conducts a comprehensive assessment of the community. After the dental health educator conduct the assessment, dental health educators draft the oral needs of the communities, provide health promotion and programs that are suited to the oral health needs of the communities. The range of topics include dental products. Dental products are substances that have an effect on teeth and dental cavity. Example of these products are toothbrushes, toothpaste, mouthwash, teeth whiteners, and many to mention. Dental services. Oral health is more vital than you might realize. It has the potential to affect your oral and overall health. Dental services are any diagnostic, preventative, or corrective procedure performed or supervised by a dentist. Example for dental services is cosmetic dentistry, such as whitening, porcelain, and composite veneers. Fluoride. Fluoride is a chemical compound made up of the element fluorine. It is a type of medicine. Fluoride is most typically used to treat tooth plaque, a minor type of gum disease, and to prevent cavities. Fluoride is also often used in dentistry to strengthen enamel. Enamel, which means the thin outer covering of the tooth. The tooth's outer covering. Medication and oral health. Oral health is affected by a variety of medication, both those prescribed by your doctors and those you purchase on your own. These are just a few instances of how medication might have an impact on your dental health. Your dentist must be aware of any medications you are taking to give you the best possible dental care. Tell your dentist about your treatment plan and overall health, especially if you have any recent illnesses or suffer from any chronic illnesses. Include both prescriptions and over-the-counter medications in your medical history. If your health or medication use changes, always notify your dentist. Nutrition and oral health. A nutritious, well-balanced diet is essential for optimal oral and overall health. Healthy teeth and gums are promoted by eating a range of nutritious foods from all dietary categories. The nutrients that the body, bones, teeth, and gums require to regenerate tissues and combat illness and disease, including gum disease, are provided by the food we eat. A well-balanced diet is rich in fruits, vegetables, protein foods, grains, and dairy provides essential nutrients for good oral and overall health. Oral diseases. Oral disease is a word that describes some of the most frequent oral issues that people face today. Dental cavities, gum disease, infectious disease, physical traumas, and oral cancers are among these issues.
Growths can originate in any type of tissue in and around the mouth, including connective tissues, bone, muscle, and nerve. Most commonly growths from on the lips, the sides of the tongue, the floor of the mouth, and the soft palate. Some growths cause pain or irritation. So next is oral health status. Oral health may be defined as a standard of health of the oral and related tissues which enables an individual to eat, speak, and socialize without active disease, discomfort, or embarrassment, and which contribute to general well-being. So next is oral hygiene for infants. Practicing healthy habits can prevent or reduce tooth decay or cavities in infants and children. Continue to clean your infant's gums after feeding. Once a tooth comes in, start to use a child's soft bristled toothbrush with no toothpaste in addition to massaging the gum tissues. Oral hygiene for children. Dental hygiene should begin when your child is a baby. Start using a soft child-sized toothbrush around the age of 1 or 2. You should brush your child's teeth with water at least twice a day. You can also add a small dab of toothpaste that doesn't have fluoride in it. So, oral hygiene for adults. So, drink fluoridated water and brush with fluoride toothpaste. Practice good oral hygiene, brush teeth thoroughly twice a day, and floss daily between the teeth to remove dental plaque. Visit your dentist at least once a year, even if you have no natural teeth or have dentures. And the next topic, oral safety and injury prevention. So, how can we keep our mouth safe? So, brush your teeth last thing at night and at least one other time during the day with fluoride toothpaste. Clean in between your teeth at least once a day using interdental brushes or floss. And the next is sealants. So what is sealants? Dental sealants are a dental treatment intended to prevent tooth decay. Teeth have recesses on their biting surfaces that the back teeth have fissures and some front teeth have cingulum pits. So the effectiveness of sealants are a quick, easy, and painless way to prevent most of the cavities children get in permanent back teeth, where 9 in 10 cavities occur. Once applied, sealants protect against 80% of cavities for 2 years and continue to protect against 50% of cavities for up to 4 years. So the last thing is tobacco. So how can tobacco affect our oral health? So smoking can impact your oral health. People who smoke are at a higher risk of developing mouth cancer or oral cancer, gum problems, losing teeth, decay on the roots of teeth, and complications after tooth removal and gum and oral surgery. So that is the oral health promotion, education, and preventive services.
Oral health program services. So there are many oral health program services. One of it is fluoride services, and under fluoride services, there are promotion of community water fluoridation, school-based fluoride mouth rinse programs in rural schools, fluoride varnish programs for infants and preschoolers at health centers and high school daycares, fluoride varnish schedule and consultations. Next is early childhood and family services, and under it is oral health information packages for new parents, oral health resources for preschools and daycares, toothbrushing programs, referrals, and consultations.
School services. We have the dental screenings of children in selected grades every 5 years. The annual dental screenings of children at high risk for tooth decay in selected grades and schools. Referrals. Oral health resources for school staff. Toothbrushing programs and dental sealant program for grades 1, 2, 7, and 8 in selected schools. Older adult and special needs services. We have the oral healthcare module workshop for staff, presentation and displays for caregivers, older adults, and special needs individuals. We have also the referrals and the consultations.
Post-secondary services. Oral healthcare module workshops for U of S and SCIA students in community colleges, upon request referrals consultations. Health promotion services. Promotion of oral health through the use of media, health fairs, and displays. National Oral Health Month activities during April. Consultations, resources, and a variety of oral health topics.
Oral health services 0 to 11 months. Oral health care providers play an invaluable role in optimizing the oral health of infants, particularly through the establishment of a dental home. In 0 to 8 months, all infants should have an infant oral examination from one of our pediatric dentists by the time they are 6 months old. The first examination will evaluate the infant's risk of developing any type of oral disease, including their risk for developing dental caries. Give instructions on infants' oral health care, advice on exclusive breastfeeding, keep the mother and baby together in bed or within easy reach. Do not separate them. Encourage breastfeeding on demand day and night as long as the baby wants. A baby needs to feed day and night 8 or more times in 24 hours from birth. 9 to 11 months, same as above, and topical fluoride application. Topical fluorides encourage remineralization of enamel and also inhibit bacterial metabolism, reducing the growth of plaque bacteria. 1 to 4 years old, oral examination. Topical fluoride application, supervised toothbrushing, oral health education, a traumatic restorative treatment or ART, and oral prophylaxis or scaling. When we talked about a traumatic restorative treatment, it is a method of managing dental caries based on 2 pillars: the sealants for preventing carious lesions in pits and fissures, and restorations for cavitated dentin caries lesions. The ARTS uses only hand instruments for opening and enlarging the cavity and for removing carious tissue. The oral prophylaxis or scaling is a procedure done for the teeth cleaning. It removes tartar and plaque buildup from the surfaces of the teeth as long as those hidden in between and under the gums.
Oral health services for 5 to 9 years old or school-age children. Oral examination, supervised toothbrushing, oral health education, pits and fissure sealant, temporary filling, and permanent filling. For 10 to 19 years old or adolescents, oral examination, education and counseling in good oral hygiene, diet and adverse effect of tobacco or smoking, and alcohol and sweetened beverages and food. Pits and fissure sealant application, temporary filling, permanent filling, oral prophylaxis or scaling, and oral urgent treatment.
20 to 59 years old. First, oral examination. Second, education and counseling on good oral hygiene or diet and adverse effects of tobacco or smoking and alcohol and sweetened beverages and food. Third, gum treatment. Fourth, oral prophylaxis or scaling. Fifth, permanent filling. Sixth, a traumatic restorative treatment or art. 60 years old and above. First, oral examination. Second, education and counseling on good oral hygiene, diet, and adverse effects of tobacco or smoking, and alcohol and sweetened beverages and food. Third, oral urgent treatment or OUT. Relief of pain, extraction of unsavable teeth, and referral of complicated cases to higher level.
Oral health program for pregnant women. So first is oral examination. Pregnancy may make women more prone to periodontal or gum disease and cavities. Oral health may be considered an important part of prenatal care, given that poor oral health during pregnancy can lead to poor health outcomes for the mother and baby. Next is education and counseling on good oral hygiene, diet, and adverse effects of tobacco or smoking and alcohol and sweetened beverages and food. Due to bad oral health in pregnancy, pregnant women can experience premature delivery, low birth weight baby, and many more. So how can diet affect oral health? The most significant effect of diet is in the mouth, particularly in the development of dental caries and enamel erosion. Next is oral prophylaxis or scaling. A study of 823 pregnant women at 13 to 21 weeks gestation found that scaling and root planning for periodontitis using local anesthetics as needed did not increase adverse fetal outcomes. However, it did lower preterm birth rates. Next is gum treatment. So, the non-surgical periodontal therapy and dental treatment, including restoration and extractions, are safe during pregnancy, and especially during the second trimester of gestation. Next is temporary filling. If you are pregnant and need a filling, root canal, or tooth pulled, one thing you don't have to worry about is the safety of the numbing medication your dentist may use during the procedure. They are in fact safe for both you and your baby. And lastly, permanent filling. It is natural to be worried about getting dental fillings during pregnancy. However, the American College of Obstetricians and Gynecologists and the American Dental Association agree that cavities can be treated safely at any time during pregnancy.
So that would be the end of our report. Thank you for listening and good morning once again.